Welcome to this podcast on the future of healthcare with Chief Business Leader of Philips Precision Diagnosis, Kees Wesdorp, and Chief of Radiology at Vanderbilt University Medical Center, Dr. Reid Omary. Join them to hear about topics ranging from sustainability to innovation. Once you've listened, share your thoughts on how we can shape healthcare together.
It's a real honor and joy to be here together with you. What are the implications broadly for people when you think about sustainability, when you think about innovation, when you think about serving the needs of people?
Huge. So we can talk about innovations in IT infrastructure and informatics and artificial intelligence, but the people, the capabilities, the leaders all play a phenomenal role. Whether it's the administrator, referring physician, the radiologist, people and capabilities is going to be key. And that sits both on the mindset part. Am I willing to adopt the change, the digital disruption? Am I willing to do my job in a different way? As well as new capabilities, because obviously working in a virtual environment is quite different. Working in an environment that is augmented with informatics inside is quite different. And so the current generation, but also the generations to come, will increasingly have to be adept working in this new virtual world with tools that continuously adapt based on the needs of the specific situation at hand. And that then also drives the direction of personalized care, where based on the context and the setting, you have the right tools at hand to get to the right steps on a care pathway.
How do you, when you assemble your teams, get them in the mindset that we really need to do something different? It's not just because it's an opportunity, but it's really our responsibility to make the entire planet better. How do you embed those values in your team?
Well, it starts with setting it as a priority, but it definitely also helped to have these sessions to hear how also leaders in health systems in the industry are thinking about this. And I have seen quite a shift over the last few years, maybe 3 years or so, where sustainability wasn't necessarily a priority when we engaged with our customers. People would find it obviously important, but it wasn't the number 3 in the Pareto of opportunities that a radiology department would think about. I think that has shifted actually quite a bit over the last few years. And so for you to keep me on my toes is equally important as for me to think about what innovations I can co-create with you to drive the sustainability agenda. And maybe Reid, it's also up to you and I to lighten that path on a sustainable innovation roadmap for the industry. Now, that is maybe a bit of a bold statement to make, but if we don't take those steps jointly together, who will?
That's a great point. And wouldn't it be an absolutely achievable future where as a radiology department, when we think about how we're going to consider our purchasing decisions, there's an expectation that we have of our industry partners to share their plan and their approaches for sustainability, how their equipment can be circular, how a modular design, how software updates can actually benefit us as users of the technology. Wouldn't that be fantastic if it was just expected?
Music to my ears. And in fact, I think it's the way to go. Eco-design for the core systems that we offer today would be an important thing to ask for. Thinking about how actually the organizations that you deal with waste, for instance, avoiding or stopping completely landfill, and so on and so forth. So I think that is absolutely the way to go. Reid, what do you think will make the difference if you think about the people that are involved in health systems and in innovation?
It's a great question, and I think we share the same incredible opportunity. And that's if we are going to recruit the top talent, we need to have a sustainability program and a sustainability mindset within our collective organizations, whether it's within healthcare, within industry. I can't imagine a successful organization in the future recruiting the top talent unless that's embedded in their values. What do you think?
We see that every day. The next generation, and also the current generation, but definitely the next generation is asking for clarity on climate action, sustainability, and so on and so forth. So that's spot on. And let me ask you the final question, Reed. What call to action would you have for health systems and industry?
So I think the call to action would be to embed sustainability into our daily practices. So in everything we do, whether we're taking care of a patient, what would be the potential carbon costs of a diagnosis? When we're purchasing equipment, what is the impact on the environment? When we are taking care of patients from afar, can we take care of them virtually? And how about you?
For me, the call to action would be a partnership approach, because it's so clear that point solutions won't make the difference. A step in the value chain will not make the difference. Only if we look at it end to end between health systems and the industry, I think we can really move the needle. And we need to seriously move the needle. Reed, thank you so much.
Thank you, Kees. It's been an honor.
Thanks for listening, and share your thoughts on the future of healthcare in the comments section.